Human immunodeficiency virus or HIV is a virus that attacks the body's immune system. HIV are two species of lentivirus that infects humans. Over time, they could cause acquired immunodeficiency syndrome, a condition in which progressive failure of the immune system allows life-threatening opportunistic infections and cancer to thrive.
Get to know about gonorrhea. Gonorrhea is caused by the bacterium Neisseria gonorrhea. The gonorrhea bacteria are most often passed from one person to another during sexual contact, including oral, anal, and vagina intercourse. The interesting fact about gonorrhea became treatable in 1937, and this gonorrhea and chlamydia often occur and infect a person at the same time. The bacterium that causes gonorrhea, which is Neisseria gonorrhea, comes from the name of Polish scientist named Albert Neisser.
What is chlamydia? Chlamydia is a common sexually transmitted disease that can infect both male and female. It can cause serious permanent damage to a woman's reproductive system. This can make it difficult or impossible for her to get pregnant later on. Chlamydia trachomatis is the bacteria that causes chlamydia, most often spreads through unprotected vaginal, oral, or even anal sex. You can get it from the semen or vaginal fluid of an infected person. It can also pass from an infected person to another through genital contact, even if there is no sex.
Syphilis is a bacterial infection usually spread by sexual contact. Untreated syphilis can cause serious or fatal damage to the brain, heart, can paralyze, and can seriously damage the bones, nerve, liver, blood vessel, eye, and joints, and other internal organs of an infected person. Many people don't notice syphilis symptoms or know they have syphilis. The initial sore caused by syphilis is painless, and if the sore is inside the body, it can't be seen. People with HIV and syphilis may be at a higher risk of neurosyphilis, syphilis of the brain and spinal cord.
Infection with herpes simplex virus, commonly known as herpes, can be due to either herpes simplex virus type 1, HSV1, or herpes simplex virus type 2, HSV2. HSV1 is mainly transmitted by oral-to-oral contact to cause infection in or around the mouth or the oral herpes. However, HSV1 can also be transmitted through oral genital contact to cause infection in or around the genital area or the genital herpes. HSV2 is almost exclusively transmitted through genital-to-genital contact during sex, causing infection in the genital or anal area or the genital herpes. Both oral herpes infections and genital herpes infections are mostly asymptomatic or unrecognized, but can cause symptoms of painful blisters or ulcers at the site of infection, ranging from mild to severe.
The first prevention is condoms. Condoms are 98% effective at protecting against most STIs like chlamydia and gonorrhea. However, condoms don't protect you from all STIs such as herpes, genital warts, and syphilis, which can be spread from skin-to-skin contact. But it is important to note that wearing protection is better than nothing at all.
If you are HIV positive, you can still have sex. In some cases, you can even have unprotected sex without putting your partner at risk for HIV. The steps you need to take to protect yourself and your partner depends on several things. These include whether you are treating your HIV with medications.
The next prevention is by talking to your partner. What I mean by this is you can have a conversation about this STD and HIV, but at the same time can ask him or her to do screening tests together. It is so important in order to avoid this kind of transmitted disease.
The next prevention of STD is by avoiding sharing the same needles for drug purposes. This is because syphilis, HIV, and any other STD viruses can be spread by sharing needles or other objects contaminated by blood, as well as through sexual contact.
Another way of prevention is don't share your personal items. Personal items, for example, are razors, cups, towels, and or toothbrushes. The use of such items and tools can sometimes cause cuts and injuries from which viruses can be transmitted, and sharing them with another person could result in infection and the spread of diseases.
Antibiotics, often in a single dose, can cure many sexually transmitted bacterial and parasitic infections, including gonorrhea, syphilis, chlamydia, and trichomoniasis. Typically, you will be treated for gonorrhea and chlamydia at the same time because the infections often appear together.
One of the treatments for the sexually transmitted diseases will be the antiviral drugs. If you have herpes or HIV, you will be prescribed an antiviral drug. You will have fewer herpes recurrences if you take daily suppressive therapy with a prescription antiviral drug. However, it's still possible to give your partner herpes.